Hypocalcemia, commonly known as low blood calcium, is a major challenge in dairy farming, significantly affecting cow health, milk production, and reproductive performance. While clinical hypocalcemia affects about 2% to 5% of second lactation and older cows, subclinical hypocalcemia is a silent predator, impacting nearly 50% to 70% of cows without visible signs. This hidden condition weakens the immune system, increases the risk of metabolic disorders, and reduces overall farm profitability. For decades, dairy farmers have relied on traditional dietary approaches to prevent hypocalcemia, such as restricting calcium intake or manipulating dietary cation-anion difference. While these strategies have helped, they are often complex, require strict management, and sometimes fail to fully protect cows from calcium deficiency at calving. Now, a groundbreaking nutritional strategy using synthetic zeolite A is revolutionizing how dairy farmers manage hypocalcemia. This novel approach simplifies feeding programs while ensuring better calcium homeostasis in transition cows. Historically, the most common methods to minimize hypocalcemia include dietary calcium restriction and dietary cation-anion difference management. The idea behind dietary calcium restriction was to limit calcium intake during the dry period to stimulate calcium mobilization from bones before calving. However, achieving sufficiently low dietary calcium levels proved impractical in real-world farm conditions. By feeding anionic salts, farmers induce a mild metabolic acidosis that enhances calcium mobilization and absorption. This method has been widely used, but requires careful urine pH monitoring to ensure effectiveness. Additionally, sourcing low-potassium forages to maintain an ideal DCAD balance can be challenging. Both strategies demand rigorous nutritional control and monitoring, making them difficult to implement consistently across different farm environments. This is where a novel zeolite A-based approach steps in, offering a simpler and more effective solution. A revolutionary method for preventing hypocalcemia in dairy cows involves supplementing synthetic zeolite A in the pre-fresh diet. Zeolite A binds to phosphorus in the digestive system, creating a temporary drop in blood phosphorus levels. This triggers a natural physiological response, causing the cow's body to mobilize calcium from bone reserves, ensuring a steady supply of calcium in the bloodstream at calving and beyond. Studies show that cows fed zeolite A have significantly increased calcium levels post-calving, reducing the risk of both clinical and subclinical hypocalcemia. Unlike DCAD diets, zeolite A supplementation does not require sourcing special forages or conducting frequent urine pH tests. Farmers can continue feeding homegrown forages. Cows supplemented with zeolite A often require fewer calcium boluses or drenches after calving, reducing labor and stress. With better calcium balance, cows experience fewer metabolic disorders, improved immunity, and higher milk yield. While zeolite A supplementation offers a promising alternative to traditional hypocalcemia prevention, successful implementation requires monitoring phosphorus levels. Since zeolite A reduces phosphorus absorption temporarily, some cows may show a mild phosphorus drop post-calving. However, this normalizes within 48 to 72 hours and does not negatively affect cow health. Every herd is different. Working closely with a nutritionist and veterinarian ensures the best feeding strategy for your cows and farm conditions. Dairy farming is evolving, and science-backed innovations like zeolite A supplementation are transforming how farmers manage transition cows. This novel approach not only enhances calcium mobilization, but also reduces the complexity of pre-fresh diets, offering a more practical and effective alternative to traditional methods. For dairy farmers looking to reduce metabolic disorders, boost cow performance, and maximize profitability, zeolite A supplementation could be the game changer needed. By adopting this innovative strategy, dairy producers can step into the future of herd health management, ensuring a smooth transition for their cows and unlocking higher milk production and better overall dairy farm success.